Every Wednesday here on 12 News Now at 4, we're joined by Dr. Jim McDonald, Medical Director at the Rhode Island Department of Health. And today he spoke with our Ted Nesi about trends that we're seeing locally. Here's part of that conversation.
Dr. James McDonald, good to speak with you. And I want to go right into, we're coming just off of the governor's briefing today. I'm sure you were listening to what she had to say, and it was a pretty bracing message for Rhode Islanders about her concern about the uptick in cases and hospitalizations that we've been seeing. You know, I'm curious, kind of, as you talk with the team of the Department of Health, what led you folks to feel, ooh, okay, you know what, we need to kind of change the message a little bit all the way at the top because of what we're seeing here?
Yeah, so Ted, what we're seeing right now is an increase in cases, and it's clear it's a trend. And I think one of the key things that we have to just be honest about is this pandemic has been a long pandemic, as pandemics go, and I think it'd be crazy to say you're not tired of it. Everybody's tired of it. But quite frankly, right now, more cases, more hospitalizations, it's just not good news. And it's important sometimes when you have news that's not good news just to get it out. And let's talk about what do we do that's different, because in this pandemic, if we aren't willing to live differently, we're just going to perpetuate it. And I think that's what you've seen nationally is, as a nation, we're just not willing to live differently. And that's really, in my opinion, why it's been perpetuated in the United States, and we haven't controlled it like other countries have done.
What changed, do you think? I know experts, you included, always told us you thought the fall would lead to an uptick in cases, and that seems to be what's happening. But, you know, is it just we're inside more frequently, or are people becoming more lax? What do you think is driving this?
Yeah, we're not even inside more yet. I think the weather's still nice. I think what's happening is people are getting more lax. And I don't want to sound like I'm judging anyone, because that's not my role. The bottom line, though, is I think people are just tired with the whole thing. And I think one of the things you see is certain age groups who are a little worried about how age groups are acting. And part of it is just accepting, you know, asking you to wear a mask, it may seem different, but quite frankly, this should be the norm by now. And I'm concerned that we're still seeing people who aren't getting that. And I think one of it too is just that when you get to family gatherings or even get together with friends, we're so used to seeing each other without masks on. And the whole point was masks weren't meant for us just to wear in front of strangers. Masks were meant for us to wear in front of everyone. And the point is, I can't tell who's carrying virus today, and I can't tell who's wearing it tomorrow. So if we all wear masks, it really does help prevent us from spreading to the other people around us. And that's why that's the message. And really what changed is, this is a really relatively nice time of the year. Things could get a whole lot worse really quickly. The governor gave an example about Wisconsin, and I don't want to pick on Wisconsin. I've been there, nice place. But we don't want to be in that situation in 3 weeks where we're talking about larger issues. There were plans that we never had to implement. We never had to implement plans of what do we do when we had scarce resources. We have those plans, but we never had to implement them. We have a chance just to corral this, get it back into a more normal spot. We just can't afford to go in the wrong direction in this. And I think that's why today was a day too important to set the message out there. And that's part of what's going to be said again tomorrow.
So is the message at this point, wear a mask anytime you're with other people other than your nuclear family that lives in the house with you?
That is exactly the message. And it's one of those things where the mask is the most important thing you can do, and stay 6 feet apart. And I think that's unnatural to be 6 feet apart from your friends. And you know, it's like our world isn't built that way. You walk down a sidewalk, you're not used to being 6 feet apart, but that's what life has to look like right now. And when you're walking with a friend somewhere, you've got to be 6 feet apart. And I think that's things where I do those things. And I'm not trying to say I'm perfect, but I haven't gotten the disease yet. And part of why I haven't gotten it yet, if I've been really fastidious in my personal infection prevention, and I insist about that with my family as well.